Red, sorry. So, just for starters, Red, just sort of stand and walk and then just stand in a comfortable position. So you want to just see where Red ends up as far as his foot alignment and where how his natural standing posture is. So don't be too forced in where he puts his feet or what direction his legs are standing in or how far apart or whatever, because that's part of your assessment initially, isn't it? So I'm just going to come and sit on the floor. So first of all, choose a way that you're going to assess, and again, like the shoulder, don't jump into it too quickly. Take your time and observe and get as much information as you can without actually putting your hands on to begin with. So our first observation is just how Red is standing, how far apart his feet are, is he narrow in his stance, is he wide, is he excessively wide, does he look like he's struggling to keep his balance? Also, you're getting a sense of, does he look like he has even weight through his feet? Does he look like he's shifted one way or the other? And this may be a conversation that you're having at the same time, but we'll get to that in a minute. So then, when you start assessing from an observational point of view, be systematic. Either go from the feet up or go from the lower back down, but choose how you're going to do it and be consistent with that, so you don't jump from feet to hips and miss bits in between. So we'll go from feet up, shall we? So feet placement looks fairly similar, doesn't it? Maybe the left has turned out a little bit more than the right, but not a huge amount of difference there. Arches of the feet.
Pretty flat.
Pretty flat, yeah. They're all in contact with the ground. Nice relaxed toes. He's not gripping with his toes, looking uncomfortable in any way. He looks fairly relaxed through his feet, and he's fairly relaxed through the arch, medial arch of the foot as well. Bit of navicular drop to my eyes on the right more than the left, but again, whether that matters or not, I don't know. Can you see what I mean there? Just a bit flatter here compared to there. Yeah? Okay, so ankles, no swelling around there, look pretty average. That's good, it's a good thing. Relatively even on both sides. Coming up from the front now and looking at the legs, you can see the medial calf bulk. You can also, so you're going to reserve that from behind as well, but you just get a sense of, does his calf muscle bulk look similar? Does the tibant look particularly overworked or tight or anything there? Looks fairly even, do you think? Any gross differences that anybody's seen? Then coming up to the knees themselves, so looking for any thickening around the tibial tuberosity, anything around the fat pad. How do his patella sit? Do they face the same way? Look relatively, so looking at the margins around the patella, can you see that groove on the, the sulcus or the hollow on the inside of the patella? Sorry, the medial part of the patella. Does that hole look the same as that one? Does that edge of the patella look the same as that? Then looking at his VMO bulk, does that look similar? Does it look different? Now I might need you to stand so just even. And then look at his VL bulk, does that look similar? And just general quad bulk there. Any major comments? Left has got a little bit more bulk to it. That's that. Okay, so remembering we've all got asymmetries. We'll find things if we look hard enough. It's just is irrelevant to what we're looking for as well. Okay, turn around for us. Okay, so sort of just walk your feet again, just get in a comfy position. Yep, okay, so looking from behind now. So heels on the ground, relatively vertical Achilles tendons, yeah? Not a lot of swelling or anything notable around the ankle. Calf muscle bulk, left versus right, what do you think? This is without any of us putting hands on. Maybe, yeah, if anything, but not grossly, is it? It's not one little chicken leg and one big turkey leg. Then look at the knee joint lines. Do they look similar? Similar height? Yep. And then hamstring muscle bulk. Does it look about the same? And then if you're looking at it's fine, thank you. Just looking at leg length discrepancy, if you're just coming into that gluteal fold there, just to look to see if there's any difference there. And there's no major difference there for Red. Okay, side on for us, Red. Okay, so just looking from right side on, looking at the posture of his knee. Can you extend your knees back any further? Yeah, so that's your extended position. So he's not in a hyper extending knee posture. And then turn around the other way. Good. And similar looking on this side, isn't it? Okay. So from there, stand face me. We're now going to look at function. So before you ask them to do anything, have a good look, see if there's anything you're looking at, and it might also help direct what your functional assessment is going to be. So when are you going to assess function? Do you do it first, or do you lay them down on the bed, assess their knee, and then do their function? Function. And how much functional assessment do you do? Yeah, maybe. What else? What else might indicate what you do? For me, I think it's about safety of the patient. So if you have someone who has injured themselves on the weekend, they've told you they had a twisting knee injury on the weekend, and you have seen them limp in from the waiting room into your room, and you've had them standing there and they look like they're offloading their leg, then I'd probably get them straight on the bed, and that would be my functional assessment. They've walked from the waiting room with a limp, and they've told me already they've had a trauma. So functional assessment may not be appropriate or safe for that person at that time. If someone says to me, I have been running 20 Ks a weekend, I get a bit of a niggle, it comes on after about 5 kilometres of running, and then it gets to about a 2 or 3 out of 10, but it's just annoying me and I want to know what's going on, then I can do as much functional assessment as I want, because they've not, in our subjective, there's been no history of any trauma, there's been no history of any story that says that there's going to be some structural damage. It's likely an overload type presentation, and he's also said he's got low irritability. He can run for 5 Ks before it comes on. So in that instance, I feel quite confident that what I do is not going to make him any worse. So essentially it's safety, listening to the irritability. Is your assessment going to blow their condition up or blow their pain up? And if they're telling you, I have an unstable knee, well, that comes into a safety concern, doesn't it, as well? Okay, but in Red's concern, we don't have any of those issues. So we're happy to go with a functional assessment straight up. So what I would like you to do, and with your functional assessment, you can choose whatever you like. Now this is what you guys are going to do in a moment. While I'll run you through a few that I do, I'll also put up a list of things you can do, and what you're going to try and do is use that functional assessment to help inform what you do next. So firstly, just standing there, so do you feel like you've got even weight on your legs?
Yes.
Great. Now if I had someone, so if you shift your weight all to one side, say if we had someone standing like this and you asked them that question, they may say, oh, I think it's about even, or they might say, no, actually, this is my sore leg, and no, I feel like I've got a lot more weight on the right. So your first functional assessment might be, okay, can you try and shift a little bit more weight onto your left to whatever is tolerable, and try and keep it even. Now, does that feel any different? Because what you want to know, first of all, is if they do put even weight, does it aggravate things, or have they learned to avoid loading that leg? So they're habitually offloading, but they don't need to be. Does that make sense? So it can be a helpful behaviour it is quite normal to offload a painful structure. You've got a limp, it's an acute phase of injury, it would be normal to offload that leg. However, that limp should then resolve. So if they have improved their pain levels but they continue to limp, they continue to have a problem, and it's a maladaptive, it's a non-helpful behaviour. So that can become the problem. So first of all, try to get even weight bearing. Does it feel even? And now that it feels even, is it painful or does it feel okay? And they might go, oh, actually that's all right. Okay, so from here, we're assuming that feels pretty good so far. Now, can you do 3 squats for me? And what you're looking for as physio is that quality of that movement. Oh, you're noisy.
It's normal.
But see, that's good.
Yeah.
So that might be someone says, oh my God, my knees creak like this, I'm really worried, I'd really try, I hate it when it does this and I try and not do it. Or you just go, oh, it's normal, that happens all the time. And we don't really know what crepitus is, and it may be associated with knee osteoarthritis or may be completely asymptomatic. It can be completely not a problem. Yeah, it's just a noise. So they've done studies around patellar crepitus in people who have patellar crepitus or knee crepitus, no pain, knee crepitus and patellofemoral pain, and knee crepitus and knee pain, and knee pain without crepitus. So the people with knee crepitus and the control group have no knee pain, obviously. Then people with knee crepitus and no pain move more similarly to the people with pain than the people without pain. So the noise can be something that changes people's behaviour, whether they've got pain or not. So it can be a discussion around that when you say, you know, understanding the crepitus, we don't actually know what it is, but it's not a diagnostic tool for a pathology. So unless it's painful for you, if you can ignore the noise, it's not going to change what you need to do, which is exactly what you said. It's just not, that's what my knees do. And also you're verbal around it too, so you don't want to go, oh geez, listen to those. And exactly when we said that we made a joke of it, and you were like, oh God. But essentially what we want to do is go, okay, that is a normal noise in some people's knee without pain. Okay, now we're going to go stand on one leg and get your balance. Okay. So looking at the strategies where Red gets his balance from, does it bring on your pain? And does the balance, when he's doing this, does it come from his ankle or does he stabilise at his hip? Ankle. So he's got a very dominant ankle strategy. He doesn't actually adjust much at his hip. The knee can't do much to adjust to the balance because it can only bend and straighten. So that's not particularly helpful. Okay, go onto your left. And balance onto your left. And again, where does he get his balance from? Got good balance. Yeah, more his ankle. Okay, back onto your right. Okay. Now, when you're ready, close your eyes. So how long should somebody be able to balance for with their eyes closed on a stable surface? Yeah, about that. So you can do all different sort of scoring systems for balance. You can have them standing on foam, you can time it, you can record the number of times they have errors. I find it easier and more reproducible. Can we try your left? Get your balance first. Open your eyes, get your balance, because that makes it too hard. Okay, got it there, and now close your eyes. So you can see the huge difference that the visual stimulus makes on someone's balance. And that's important because if you're playing sport, you're not thinking about your balance, are you? You're thinking about where your opponent is or where the ball's coming from or where you're running to. So you're not, it's not about being able to fix your balance with your vision. You've got to be able to rely on other systems. Okay, back to your right, eyes open. Now, can you do 3 single leg squats for me?
Pistols?
Whichever you like. When I do this, I just go, you do you. I don't mind.
Shrimp squats.
Yeah, I'm impressed. I was impressed with your squats in the first place, so
Double
that's very
leg
good.
big reputations.
Yeah, his knee doesn't creak.
Yeah.
Your knee doesn't creak when you do single leg. That's interesting. So we're looking at a difference right to left, and obviously Red's got above average squat capacity. That's very, very good. It looks harder, and we said your left muscle looked better from a bulk point of view slightly.
Balance and single squat harder.
Harder on it. So you could go from squat to single leg squat, but you've got to know what that balance is like, because what you want to know is, obviously Red can balance really well with his eyes open. So his single leg squat, we're now introducing other elements, but if we go straight into a single leg squat and he's already unbalanced, that's going to make it very difficult for you to be able to squat, because that's a step up from standing stationary with your eyes open. Okay, so we've looked at sort of double leg squat to get a feeling of how they move through their hips and knees, have they got enough strength to get up and down. As with more advanced tests, go into single leg squat. So another knee flex floating exercise, we can do a lunge. So if you just, yep, that's good, just stepping and looking at how they lunge and getting them to do a couple of lunges there. And when the lunge, asking about symptom reproduction both for the front and the back knee, and then swap over, because it may be, if you're going front leg forward, maybe the back knee that actually gives you symptoms. And looking at the difference there and alignment there. So normally, Red, can I get you to face us? I would do a lunge facing on, because in this position, what might you be looking for? Yeah, looking at where does he naturally go with that. Now you might have seen it on a single leg squat as well. This would be sort of from a functional level in between those two for most people. But then if you've got someone with patellofemoral pain, they can go deeper. So if you do your left one for me, they can go deeper. The normal person can go deeper in a lunge than a single leg squat. You're just very good at a single leg squat. So they might limit their range a lot when they do a single leg squat without the capacity. You can get further down there. So if we're looking at some loaded knee flexion tasks, they can be helpful. If they've told you in their subjective that that's what they find difficult, then that can be something that is useful to you. Okay, now, double leg, can you just bounce on your toes for me? Yep, like that, okay. So what might we be getting an idea of when we do this? And just pause.
Stress, causing stress plyometric.
Yeah, so that plyometric load, what does that do? So what structures might that give or reduce some pain with?
Achilles.
Yep, Achilles, and around the knee. Patella tendon potentially. Yep. Also, if they have meniscal pain, sometimes jumping on it doesn't feel comfortable. What about if we get used, so we've looked at double leg, so nice and stable, so let's go to single leg, go to hop on each leg. 3, and go swap. Does it feel the same? Now, can you do that again for me? Don't overthink it. What I want you to do is listen.
Heavier.
Yeah, heavier on the left, isn't it? So go right again. Go left. So that sound can also be something like you could hear that.
I feel it, so
Does it feel different?
feels heavier.
Yeah, it feels more difficult.
It's more impact.
Yeah, so then we're going, okay, so why is that? Is it relevant, or is it just an observation that you have a leg dominance and feel different? Or is there something going on with your ability to absorb load, and how does that work in with the subjective story that we're hearing? Okay, so from here, we've looked at double leg horizontal, up and down, vertical, single leg vertical. Now we're going to look at horizontal. So maybe from here to here. I just want you to do a series of jumps. Now, not big bounding jumps, I just want little, this sort of thing, forward. Yeah. And again, reproduction of pain, but also how does it work? And as Red goes back, sorry, pause. As just for things to look at, Look at where his feet place. Look at where do his knees go. What drives how he lands through his knees, okay? So jumping forward. Good. And can you do that again? I want you to observe, I want you to feel, but don't say. Turn around. Does it feel like you've got even weight and push through both legs? Go. Does it feel even to you? Yeah? Did it look even? I thought you looked better that one. The last one I thought you pushed more right than left.
Right,
The
yeah.
first, yeah.
Push it.
So now we're going to test that a little bit more by isolating it. So now I want you to do, first of all, do your right first, hopping forward to the end of the grass. Good. Left. Does one feel easier or harder? Go again. And you guys watching. Yeah, and the other way. Yeah? Easier. Left. Okay. Yeah, okay. Right, now, turning around again. So now we've gone vertical, horizontal. So we're looking at different components. Now, the last thing we'll do at this point in time is I'm going to get you to do a single hop to distance as far as you can. Okay? So starting from here, single. Starting from here, and I'm not going to do a big one. You're going to do a big one. Do a hop, land, whoop, and stick it. You've got to balance it. Okay? So we'll get you started. Yep, when you're ready, hop and land. Much better than mine, I would say. Okay, and back. And then go left. Good, come back. Now, you're going to do it again. You have to stick it. You can't hop
Okay,
second,
okay.
just one hop. Not two hops.
Single.
Yeah. Hop. That's it. Okay, so note where red lands there. Good, now do it on your left. Yeah, pretty much the same, isn't it? Now, obviously, you can measure that. We can see, so I was just lining you up with the bend there. But, you know, we can look at the distance, so it gives you an idea of how much power, but it also gives you an idea of confidence, and it gives you an idea of strength. So it is not one thing that you're measuring with the hop test, but it is something that then you can go further and go, okay, is it confidence? Is it strength? Is it spring? Is it stability? Is it, control from the hip? And now, as we keep going through, we're going to start assessing different things to work out where we need to target. So we might go, okay, your balance is great, but your strength at your hips is not really great. We're going to start working on that to target that movement forward. So with your functional assessment, again, thinking about your undergraduate days, you would just do these because that's what you're supposed to do. However, now you're starting to think about those tests, the information that they give you. So I do a couple of tests where I'm getting some loaded knee flexion. I do a couple of tests where I'm getting some spring. I do vertical, I do horizontal, and then if I'm pushing, I might want to do some more power type movements.
What about like multi-directional toe touch?
Yeah, you can look at balance in that way as well. The other thing that is very useful around these is doing a step up, just a regular step, because obviously people will often tell you that that is an aggravating activity. Now, if we, do we have a step? Any rooms? No, that's okay. That's all right. We can use step, but it's a little harder. No, that's okay. It's not too much of an issue. I just want to show you also. So now we're going to go and think about that symptom modification procedure that we did around the shoulder. We're now going to look at doing that around the knee. So we're going to use a lunge for you. So if you're going to just go into a lunge, and we're going to say it's your right leg going down, and that midway down you get pain in your knee. Okay? So you go, into a lunge position, and yep, pain in my knees somewhere, okay, and then come up. So we might say, okay, how are we going to modify different components to see if we can get a change in that pain, okay? So go back into your lunge position, and that hurts there. So the first thing I want to do, maybe I want to try and initiate a little bit more movement around the hips. So come up to the start. So that's non-painful, that's what we're saying. I'm going to get you to push a little bit out on my hand, here just a little, and lunge down into that position again. Does that make any difference? Does it change the pain or does it not? So we're looking at if we can get it, sorry, I'm not trying to push you over. If we're not trying to get a little bit more maybe external rotation in the hip, most commonly we'll see people roll in, won't we? And we've also said, say for Red, that his foot is flatter, so maybe he needs a bit more help at his hip. So I'm starting at his hip going, okay, give him a cue to push out a little bit. You can use other cues. I can say, okay, as you lunge down, I want you to keep your kneecap over this third toe. So you can use cues like that. It doesn't have to be a push out against my hand. There's many ways to do that. But my purpose here is to try and go, okay, can I get a bit more glute function here? Okay, next. Coming up, so if he says, no, actually that makes no difference whatsoever. Okay, all right. Let's try, can we change something around the knees? So is it patellofemoral pain? You can use that, I don't mind. It's not a balance on this one. So is it patellofemoral? So can I do a medial glide at the patella? So you have to do that with a relaxed patella there, obviously, relaxed quad. That's good. And then do your lunge again and just tell me if that feels any different. So I'm trying to maintain that medial glide and up. I'm going to be most effective in that position from 0 to 30 before it goes into that trochlear groove, but I want to see if I can modify it. So sorry, do that again for me. So glide and maintain that glide the whole way through. Does it change it? He might say, yeah, maybe it does. Then you could trial doing some tape and you could do it again and see if that makes a difference. And then if that makes no difference, maybe we go, okay, why don't we try it from the foot up approach? So in this instance, I'm going to get you, not so much on your little toe, but just pick up a little bit more there. Yeah, active through the foot and get a bit of an arch happening here. Okay, and then into a lunge. Good, and does that make a difference? Okay, so we've got some ways that we can approach it to modify different symptoms. It may be, do it again for me, come down. He's quite quad dominant, so we want to increase more glutes. Come up. Now I want you to relax your body forward a little bit more. Forward here is going to initiate more glute max activation, maybe a bit body back, weight back a little bit. And does that make a difference? Can we change things in different ways? So have a rest. Thank you, Red. You've worked very, very hard. So now what I want you to do, you're going to do this part. Be systematic. I want you to do your observation first. Look at the person in front of you. Can you see differences? Now, Red hasn't got any knee problems. You don't have any knee problems, do you? Did I ask that? No. I just assumed. So Red's got no knee problems, but we can see some small differences. And then some things he looks great at, and other things maybe your balance eyes closed, your kryptonite. Is the things that we're observing, but maybe some small differences in muscle bulk differences. Overall, he looks pretty good. You can get very minute in the differences that you observe, but they have to be relevant to the person in front of you. And say he does have a slight bulk difference, it's not giving you many issues, and it's only small. So, you know, see. So have a look at the person in front of you, hands off, observe. Then what I want you to do, can't go around the corner. There we go. Assessing function. Start with assessing that function and think about those different ways you can assess it. Your gait assessment can be formal and informal. So they've already walked in. And if you think you've seen something but maybe it's a little bit more subtle, well, maybe the first thing you do is get them in a space where they can get in a normal stride and just say, just relax, I just want to look at how you're moving at the moment. And talk to them. When you're walking, does it hurt? It might be part of the subjective. They said, when I walk, sometimes when it gives me pain. Do you have it now? Let's have a look. Hop tests, looking at distance, looking at crossover hops, many different ways you can look at hop tests, and there are standardised hop tests. The ones I tend to use are single hop for distance, triple hop for distance, and a crossover triple hop. Change of direction, how they wait there, is there some sport specific function that they're doing every time I do this, it hurts. Look at their single leg balance. Jumping, hopping, lunging with, I've got pogos and bunnies, so for me pogos are double legged and bunnies are forward double legged, okay? How they step and balance. You know, you can take that function right back. We've gone to high level function tests with Red, but it may be something you just want to go, I just want you to move forward. How do you stabilise? And that's, yeah, and functional. The best one you can do is what they've told you hurts them, okay? So do some early ones that sort of clear things off, but the best one you can do, it hurts when I go upstairs. Okay, well, we're definitely going to be looking at stairs, for example.
Trigger the symptom. We
Yeah.
want to find out what triggers it.
Yeah, and then if you can modify it, like the shoulder stuff, if someone says, every time I go to get out of the chair, it really hurts, you go, okay, well, let's practice that. Let's see what hurts you about it. Where does it hurt you? What can we modify and can we change it? So that is always going to be the most powerful thing, because it's the most important thing. They've told you that bothers them. So that's what I would like you to do. Choose your functional tests, choose an aggravating function, and then try to modify different components of that movement. So unless you've got someone that you're working with who's got knee pain, you're going to have to role play this a little bit, okay? Look at changing trunk, look at changing up, down through the trunk, weight shift, look at hip, internal, external rotation, stability on one leg, activating through their glutes a little more, patella changes, where their knee sits, so do they lunge with their knee coming further over their toes, do they lunge and knee coming a bit further back, movements at their foot and ankle, and see if you can role play through that as well, okay? Like we've just done here. So let's spend next time doing that.